Hello, everybody. It's Facebook Friday, but it's not. It's Facebook Thursday. I'm just going to wait for a couple of people to join in just to make sure it's all working, um, and we'll get chatting soon. There's been some really good conversations in the Facebook group today, and I can see someone's already joined us, so that's really great. Maybe if you can just send me a little wave if you can hear me talking, and I know I can get going on things. Um, uh, the other thing that's been happening along with the Facebook groups is our Zoom groups have been really starting in earnest. And so for all of our groups that meet around Australia, um, we obviously had to stop meeting face to face. And what better opportunity to really try something new? And I suspect actually Zoom's becoming part of many people's vocabulary. And we've had lots of people try that for the first time this week in their group. So we've had Brisbane, we've had Adelaide, let me get this right, we've had Royal North Shore, we've had St George, and Coffs Harbour. So it's been quite a lot of zooming going on, and I think I'd be interested to hear people's thoughts. Maybe you might want to comment below if you joined one of those group gatherings. I think everyone would agree that it's not the same as sitting in the same room. You can't give someone a kind of a sideways sympathetic glance like you can do in a face-to-face group. You can't touch someone's arm and say, hey, I know what you like, you know, what this is like for you, or I've been through something similar in the same way. But I think given that we can't do that, it is a really useful way of being able to feel connected to each other and hear each other's stories, share each other's experiences, and learn from each other and get more tips and strategies about how to cope, particularly in these very challenging times. So thanks everybody for taking the plunge. I know there was a heap of people. There were heaps of people who stepped outside their comfort zone and really, gave it a good shot. And I was pretty pleased. There were relatively few technical glitches. We all learnt lots about how to work in this space. And the good thing about this is that all of the groups will be able to use Zoom for as long as we need to. But the other thing, and I was hoping I was going to be able to announce dates right now, but I've still got a little bit of diary wrangling to go before I can announce some dates. But I think the other thing that we've learned is that actually there've been people joining our Zoom groups who wouldn't have been able to come to a face-to-face group because they just might not have been quite up to getting in the car and traveling somewhere, or the somewhere might be a long way from where they live. So I think we had someone join into one of our Sydney groups who was beaming in from Wagga. So I don't know, once things get back to normal, we're actually going to be starting a group in Wagga. But but there are lots of people, 40% of the people who call me on the net nurse line live more than an hour away from their capital city, which is where most of our groups are. So I'm really excited that we're going to be starting up an open group for people who are part of this network, that they can, and we'll probably run that every month while coronavirus is going on, and we might look at the frequency of that once things settle down and our face-to-face groups start up again. But I'll be announcing dates about that soon, so it's a bit of a watch this space. We thought we'll get the Zooming. It's been a busy week for me, as you might imagine, setting up lots of Zoom meetings for our face-to-face groups, so that's been the focus this week. But once we've got those meetings kind of bedded in and ticked off, then we can certainly look at an open group. And I know lots of you, I can see lots of people who are joining us from all over the place. And some people, the more the merrier, but some people it's just, they've never had a chance to come to a group ever. So we're really pleased to be able to give people that opportunity too. So a few things that I'm going to talk about today, and as usual, I'm going to try and be quick and concise, and we'll all see how that goes. You know what my track record's like with these things. A bit of an update about COVID-19, because that's how this all started. So the first thing is that overall things seem to be actually a bit more encouraging. I know the Chief Health Officer and those in charge seem to be looking a little bit less harried. Certainly we can see that lots of people have been doing a great job staying at home and self-isolating. I think the crunch time might actually be Easter. because a lot of people do have, very strong traditions in their family of going away for Easter. And I know I'm getting messages from all of my mobile phone providers, from my people who give me my electricity bills, from everyone saying stay home this Easter. So they're very much trying to get their message out. And I guess especially for you guys, with nets and a lot of you being more vulnerable, we certainly want to continue you staying at home. And I know those four walls can get very monotonous. I'm going out in sympathy. I haven't been out of the house apart from to exercise for about 3.5 weeks. So we're getting to know each other very well in my not that little family. And, my teenagers are learning just how important the dishes are for a happy mother. I'm sure that you're learning those kinds of lessons in your family too. I think the other thing that's tricky for a lot of people is not being able to connect for grandparents and grandkids. So I know we've got a lot of grandparents in our network, and I imagine that you're really missing your grandkids. And I don't know if anyone has seen on ABC the 7:30 report, which is usually very serious, and it still is even more so at the moment. But a few episodes this week, they've actually featured video calls or video messages from grandkids sending, their greetings and their love to their grandparents. And I don't know about anybody else. I think you'd have to be a stone to not be in tears by the end of those little segments. So if you're feeling like, I don't know, you probably will shed some tears too. But if you feel like a little bit of heartwarming, that's a nice place to go. Just the end segment of the 7:30 report for a couple of nights in the week. So anyway, here I am blabbing along as usual. I'm so sorry. COVID-19, just a few things to update. I've told you heaps. I've shared heaps of information on the page. We will continue to update our website. I'll try and hop in and let you know when there's new information up there, because I know it's really boring to go to the same page and think, oh, that looks the same as last time I saw it. So I'll try and hop into the Facebook page when there's new stuff that's been uploaded. Probably the most recent thing that was put up there, not on our page actually, it's an update to the Cancer Council information, and that's a list of frequently asked questions. The feedback that I've heard about that is that it's actually really useful. There's some very useful questions and answers on there that might be useful for you. The other thing I would say is that I'm so sorry, I got distracted because Anthony Camilleri said, "Hi Mark, I love you," and I was like, that's got to be Mark's dad. We all know Mark. Hello Mark, hello Mark's dad. Sorry. What was I talking about? I was talking about, someone remind me, I was talking about, help me. Anyway, okay, I'll just go to the next point, and if it comes back to me, it comes back to me. Injections was the thing it's on my list, so I'm going to talk about that. You've just witnessed a Kate lapse. Lots of people interested. Oh, that's what I was talking about. I knew it would come back. Website, frequently asked questions. If you have questions on there that you would like answered that aren't on that sheet of paper, and you think there might be more than just you who's interested in knowing, thanks Kim, you're doing well, thanks for the prompt. If you think there's questions that should be on there that aren't, or that you would like answered and you think, gosh, this will be more than me who's interested in the answer to this, then let me know, because I'm meeting every week with the group that's producing those frequently asked questions and helping to provide the answers. We're working really well, all of us, the charities, so that's people like the Leukemia Foundation, the Breast Cancer, all of them, the Ovarian Cancer Australia, Cancer Councils, all of the major charities are working really closely together to get this information right. The Cancer Council Australia is like the central source of truth, where those updated documents are held, and we're linking very much through to that stuff. So frequently asked questions. What I did want to talk about was injections. So there's been quite a lot of conversation in our Facebook group this week about people who would normally either go to a hospital clinic or their oncology clinic or their GP for their somatostatin analogue injections, and just being a little bit concerned. There's two concerns that people have had, or three really. Whether it's really safe to go, out in your car, can we reduce that risk, I guess, of walking through a crowded hospital foyer, or sitting in a crowded GP clinic, maybe where people are coughing and sniffling, and also for people on home injection programs, they also wanted some reassurance about the infection control measures that those providers, either doctors or GPs or nurses, though the sort of precautions that they were taking when they were coming into the home to give their injections, because they were also, thinking, well, am I going to be allowing coronavirus bugs into my house? And the third thing was around availability of those medications. So starting at the top, both companies who make the somatostatin analog injections have said that they have capacity to expand the providers. I keep looking at the comments and it's distracting me. I apologise. I'm scatty today. It's Thursday. It's not Friday. Anyway, both providers have said that they are happy to take new referrals for home injections. So for those on Sandostatin LAR, that's a GP or a nurse coming into the home under the eShine program. The eShine nurses have all had and GPs have all had an update in infection control. They've all got enough personal protective equipment. So if they're coming into your home, you can rest assured that they've had adequate training and they will be following really careful procedures. The other thing I would just say about that is that what would I say about that? Oh, please check in with them. If you're not well, like if you've got a sore throat or a runny nose or a fever or a cough, any really flu-like symptoms, we want you to let them know, because obviously we want to make some alternative arrangements for that injection. The last thing we want to do is put anyone at risk. And they also, those doctors and nurses will be very careful. And if they're not feeling well, obviously they won't be coming to your own home. The Assist Beyond program is a program that actually trains people to either self-inject their lanreotide, or someone in the home, or a GP or a clinic nurse to provide that injection. So they provide the training and support. Now, normally that is 3 visits to the person's home or to the clinic. So actually 3 months, if you started on that program, if you got a referral to that program now, that would give you, your April injection, May and June. And then July, a decision would be made as to whether you were right to fly solo with those injections. And a lot of people are actually giving it a go and finding that's not so bad. I think I probably would want a gin and tonic, but that's just speaking personally before I gave it a go. Anyway, I won't talk about the needle. I know you hate nurses talking about how big those needles are. The other thing is that the Assist Beyond people, if you don't want people in your home, which is absolutely fair and reasonable, they can actually do online training and support in a similar way to I'm beaming in with you on Facebook Live, or our Zoom groups where we can see each other. They can actually talk to you and sort of walk you through how to give the injection, or support you giving your own injection via your phone and your microphone and your camera. So that's pretty magic. So just to let you know that that's available. The other thing, the concern was around availability of medication, and there was a little bit of a nervous hustle in the group yesterday as someone was told by their pharmacy that there was a shortage and they weren't able to get more beyond the injection that was due this month. Reassurance from both drug companies that there is plenty. The supply chain is very secure for somatostatin analogues, and the companies know how important this is for people to feel like their therapy is going to be continued during this time. So the way it works is that the drug companies have a supplier, and the supplier then supplies to the pharmacy. And so probably what we're thinking happened in that situation was maybe the supplier had run low on the product, but there's plenty with the drug company, so they just need to adjust their flow. And I guess probably a lot of people are ordering it in from local pharmacies as opposed to hospital pharmacies, perhaps more at the moment. So maybe that's where there was a little bit of a lag in that coming in, but there is plenty. I think the tip that came out most on the Facebook conversation was order it in early, at least 2 weeks. I would go a month. And if your local pharmacy knows that you're going to be on it and you're going to be getting it each month, and you give them some notice of when you want to pick that up, that'll give them enough chance to get it in time. The other thing about pharmacies is that a lot of them now are providing home delivery. you know, usually that's on the day that the script goes in, but obviously if it's something like a somatostatin analog injection, you need to give them some notice, but they can deliver even those injections. So again, just to save you a trip outside of the home, it's worthwhile contacting your local pharmacy and asking if they would be able to home deliver your medication to your home, whether it's somatostatin analogues, whether it's seizure medication, whether it's pain relief, whether it's whatever. So just to say that out loud. Along with home, just to bear in mind that groceries are often also able to be delivered. So I know Woolies started up their priority service quite a while ago, and I have a feeling that Coles has probably done that by now as well. I haven't actually got an update. I haven't read all of the emails from Coles because they seem to be sending me emails every day, and I don't know about you, but there's a lot of emails. Mark's just said that Peter Mac is a home, they can home deliver as well, their pharmacy, so that's good to know. Yeah, so just worth checking out if you're if you shop, it's going really well today. If you shop at one of the major chains, check out whether they can deliver to your home. They'll leave the groceries on your doorstep. It's usually remote payments, so you usually pay via their website. Pharmacies might do contactless delivery, you know, payment. There'll be various ways they can do it where you're not having to shake hands or, you know, touch anybody or be even in that person's shop. The other provider that has been in touch with us this week was actually a metropolitan pathology lab called Melbourne Pathology, but I've heard that other pathologies in other places are doing it as well. So home pathology labs are increasing their services for people to have blood tests in their home. So that's worth checking out too. If you're due a blood test over the coming weeks, you would normally go to the hospital just to get the blood taken. Maybe you don't need to do that. Maybe you can ring the provider and ask them if they can come to your house and do it. And they would, I expect, be following the same kind of infection control procedures as the nurses who give the injections. So just to bear that in mind. The other thing that a lot of people are having to kind of learn about this last few weeks is telehealth. The doctors, the oncologists, the nurses, the clinics, the admin staff are also having to learn a whole heap about how to do this. And I listened into a conversation about this earlier this week with representatives from lots of different services, and it's actually quite tricky for them to set this up on a large scale at very short notice. So each clinic's doing it slightly differently. For some major hospitals, they've got a single kind of interface that their hospital means that they need to use. Other doctors are being a little bit more able to be a bit more flexible and are preferring things like FaceTime or Zoom, or, you know, they're able to use what the patient already might have on their computer, which is great. Although there's always, with these sorts of things, there's always the privacy stuff too that we've got to keep in context. So I'd be interested to hear how you're going with the telehealth. I spoke to one lady who will remain anonymous, whose beautiful oncologist thought, oh, I'm going to ring this person and just give them an update on what the multidisciplinary team meeting said while I'm thinking of it, and got her as she was hopping out of the shower. So she was sitting on, and please don't worry, I will not breach your anonymity, but dripping in a towel, perched on the side of the bed, nude, while the doctor's telling her about tumours and growth and scans and tests, and expecting, well, clearly the doctor, thank heavens it wasn't a telehealth, hey, or a camera view, but FaceTime in the shower is probably a little bit more information than any of us wants to really be providing to each other. Yeah, so the doctors don't necessarily know what they're interrupting you in, and I guess from their point of view, they're sitting in their office, they're thinking, oh, quick, while I'm thinking of it, I'll ring this person. So maybe just tell your doctor if you're nude or you've just got out of the shower, and could you call me back in 10 minutes and give me a chance to stick some undies and a bra on? That'd be great. Sorry, I've just revealed the gender of the person. Yeah, so telehealth, tell me how it's going. If a phone conversation without a screen isn't really cutting it for you, for some people that's actually fine. They don't really need the visual. For other people, the visual's really important, and I think it's actually most doctors would prefer that as well, because they see a lot. When they're looking into their phone screen, they can at least see your colour, they can get a sense a bit more about how you're breathing and how well you look, what your weight's sort of doing. Like, you can tell that from a person's face a bit more. So we're trying to, we're all trying to get those video calls going up and running. Some people are just using the phone and but I'd be interested to hear your feedback about that too. So I just wanted to talk a bit about the one thing that's come up in my phone calls this week, a whole heap, is, I'm so sorry, is it lunchtime for anyone? I'm going to talk about diarrhea. The first thing before I forget is there's a really fantastic fact sheet on our website about diarrhea. So I would encourage you all to hop on there. There's a section that says I'm a patient. If you click in there, there's a section on resources and there's fact sheets in there with the diarrhea fact sheet. I'm so proud of it. My kids think it's totally weird that I get very passionate about diarrhea, but I don't care. It's really, the fact sheet's great. The reason I wanted to talk about diarrhea is that lots of people think that diarrhea is part of carcinoid syndrome, which it absolutely is. But with somatostatin analogues, which is those monthly injections, you can get a different sort of diarrhea. And that's the one that's come up this week a few times. So you might remember, for those of you who logged in last week to Facebook Friday, I talked a bit about how neuroendocrine tumours work, that they grow from normal neuroendocrine cells. Those cells have a mutation and they turn into something that is still a bit like a neuroendocrine cell, but behaving really differently. And one of the things they do is grow out of control, get bigger, make lots more cells, turn into a lump, spread around the body, and also squirt out often too much hormone at the wrong time. So the somatostatin analogues, you might remember, are like a key that fits into the lock and turns that cell off and stops that cell from being able to produce hormone, which is good. We don't want them to be producing too much hormone, but also stops them from being able to make as many new cells. So we slow down, or we stop, or stop the tumor growth. Sometimes we see tumor shrinkage, which is great when that happens. The thing about those injections is they don't have brains, these injections. They can't tell when they inject that into your bum, usually, or into your thigh. When you get that injection, that medicine can't tell the difference between neuroendocrine tumours and the normal part of your neuroendocrine system that's supposed to be squirting out hormones and working well. And so what happens is that we stop the tumours from being able to produce too much hormone, but we often stop normal neuroendocrine tissue from being able to produce hormone as well. There's lots and lots of different hormones that these tumours, but also these cells, produce. So that's often what leads to the side effects of these medications. And the one I wanted to talk about was diarrhea. So obviously, when we're giving you a somatostatin analog injection, we want to stop tumours producing too much serotonin so you don't get diarrhea. But if you're not digesting your food properly, because you don't have enough of the enzymes in your gut, it can actually cause diarrhea. And isn't that so weird? We're giving them an injection to stop diarrhea, but the side effect might be that you get diarrhea. It's just crazy, but that's exactly what can happen. The diarrhea is different. So my apologies, if you're eating lunch, just maybe put it to the side for a sec, because I'm going to talk about the difference. So the carcinoid syndrome diarrhea is usually all of your food coming through too fast, and it's usually very liquid. It can be really watery with some particular hormones can give you a really watery diarrhea. Sometimes there's just lots and lots and lots, going to the toilet all the time, not getting very much notice, but it's not, it's usually just loose. Can I say that? With the somatostatin analog diarrhea, that's different, and we call it steatorrhea. Steator means too much fat, and that's because one of the enzymes that seems to be really limited when we give people these injections is an enzyme called pancrease, and that's the enzyme that stops that helps you break down fat in your gut. So if I went and had a piece of cheese, my pancreas would squirt out some pancrease into my gut, and that would break down the fat in the cheese to be absorbed in my body. And the really important thing about that is that there's vitamins in fat that we need. So a lot of people think, oh, low fat, my body's not producing fat, that might be good. I might lose a little bit of weight if you need to lose weight, or maybe it's not so bad. But actually fat's got really important vitamins, and a lot of people with this sort of situation find it difficult to keep their weight on. So we want you to have the fat. What happens if you don't have pancrease going into your gut? So if my body didn't produce pancrease after I had that piece of cheese, what would happen is that fat would stay in my gut, and it's actually not very nice. Guts don't really like it when fat doesn't digest well, and you get bloating, you get wind, and it's really smelly what comes out the other end, but also then often it causes a lot of change in your poo. So the poo for Diarrhea is pale. Um, it's floaty, it's hard to flush, and it's oily. So it leaves a residue on the loo. It's really hard to clean the toilet, but it's also hard to wipe. So in these dire days of toilet paper shortage, this is not good news. And you might find that if you after if you're wiping and it's really, what's on the loo paper is really oily and smelly and hard to clean up. I'm so sorry to be so graphic, but this is important, guys. If you're finding that with your somatostatin analog injections, or often if you've had a Whipple's procedure too, you'll get this because you've got no pancreas to squirt out the enzyme. So the important thing is that we can fix it. It makes it sound very simple, but we can supplement your diet with the enzyme so that you can break down and absorb that fat. The enzyme is called Creon. So it's Creon. So there's information about Creon on the Diarrhea fact sheet, and there's also information about it on the vitamin and minerals fact sheet on our website. Important couple of things quickly about, Mark said, good on you, Mark, baby wipes, hell yeah. Totally agree, just don't flush them. Please don't flush them. They need to go in the bin, in a plastic bag in the bin, preferably. Creon, the thing about Creon was that it was really developed for people both after a pancreas removal, like a Whipple's procedure, but actually, from my experience as a nurse, where I saw it most was people with cystic fibrosis. So especially children, historically, with cystic fibrosis, their system really gums up and the pancreas can't get through. So they often take these tablets. And because of that, the suggested dosage level is actually quite low. So if you've got a GP, you've got Diarrhea, you go to see your GP and say, hey, I heard this from the net nurse. Is it worth trying Creon? It does need to be prescribed by a doctor, and a GP can prescribe it, but your GP may never have prescribed this before. And if they look up their little book of this medication and the guidelines for prescribing it, they'll probably start you on a very low dose, which is absolutely appropriate. The important thing is that the dose will be different from person to person. So some people need to take a little, some people need to take heaps. So if it's not working and you're still getting that Diarrhea despite taking the pancreas, it may be that you're not taking enough. The other important thing, and so the dose needs to be calibrated, and the best person to help with that is a dietitian. Great thing at the moment with coronavirus is that our dietitians are now able to you're able to claim a rebate on your dietitian's consult, which they weren't able to previously. So if you need to see a dietitian and you don't know who to see, have a chat to me, have a chat to your hospital. Bear in mind your GP may have never heard of this, and they certainly may never have heard of this for this purpose. So we're all on a learning curve, all of us. So the other thing about pancreas that's really important is that you need to take it with your first mouthful of food. If you take it after your meal, it's too late. That piece of cheese is well truly down in my gut, and the pancreas is only just going in my mouth. They're never going to meet before it gets to where it's going to cause a problem. So you need to take the pancreas with the first mouthful of food. If you're only getting a couple of days of Diarrhea after your injection, we probably don't need to worry too much. Just go easy on the fat in your diet for those few days. But if you're getting it, some people get it all month through, and we don't want that because you will become vitamin deficient. You may also have trouble with your weight. And also it sucks. It's awful. Like, it's really unpredictable. It's hard to go out to people's houses because you're worried about making a mess in their loo and all of those things. Give me a ring if it's all very confusing. Have a look at the fact sheets. Send me an email if that's easier. The other thing I'll just say is that the phone is going through to message bank, and there's a little out of office on my email at the moment saying I'm a bit busy. They might just thank you for being patient. And it doesn't mean don't ring me. Please do keep ringing me. Please do keep sending me emails. I'm definitely keeping on top of it. I'm not, everyone's so beautiful and saying, Kate, don't burn yourself out. Don't work too hard. I'm fine. I just want to make sure that people, especially if they're new, like if they're ringing me for the first time and I don't call them back for 24 hours, they might think that it's gone to no one. So I just wanted to, put that message on there so people know that it is a little bit busy. So I think I've said enough about poo and bowels for lunchtime. The other thing that I wanted to talk to you about is exciting, and this is the 1,000 Steps Challenge that you might have seen in a little special edition of our e-newsletter that just came out yesterday afternoon. Our gorgeous Simone did a Facebook Live from our Facebook page this morning. You might have seen her on her glorious beach. Like, no sympathy for self-isolating when you live in such a beautiful location. All of our team are signing up to this challenge, and we'll be roping our family and friends into this as well. It's not a fundraiser, and a lot of people are going, really? We don't have to try and raise money? And like, well, of course, if you want to donate, sure, but we know that actually this is tough for everybody, and this is more about building community, and encouraging us, giving us a little bit of motivation to, despite the lockdown, see what we can do about being active. Now, we know that for people with nets, 10,000 steps is going to be pie in the sky for most, actually, even without nets. 10,000 steps is a lot of walking. So the challenge is called 10,000 steps because that's the website that we're using. It's a platform that we're using. But if you only get to 1,000, well, that's fine. Maybe next week you could get to 2,000 or maybe 1,500. You know, for some people, walking to the letterbox is exhausting, and we really hear you. So it's about making, I guess, you know, setting your targets low, making small gains, and celebrating what you can do. And I don't know about you, but in Melbourne today, it is a glorious day, and so it's you know, it's I guess in autumn it's nice weather, and I think it's going to be a long winter for us all. So I think Kim said unattainable. Yeah, 10,000 steps for lots of us is unattainable, and it might be just around what you can do walking around your house. We totally hear that. So we don't want anyone to be put off by the name 10,000 steps. It's just the platform that we're using, and quite frankly, we've chosen it because it's free. Because, you know, we're all trying not to waste any money in times like this. So 3 important steps if you would like to, and it's a 6-week challenge. There's going to be things I forget to say about this, so I'll put some notes in as well. But there's, really importantly, there's 3 steps to this challenge. The first thing is that there's a registration link, and that's on the letter. That the e-newsletter that came through yesterday afternoon. So I will put the link once again into the Facebook group, and I know Simone's already done that this morning, so I'm sorry, you're going to hear a bit from us about this. The next step's really important. So that sort of signs you up for, you know, as a kind of a user of their web platform. But to link in with Neuroendocrine Cancer Australia, you need to send us an email. I'd love it if you didn't email me about this, because my team beautifully are trying to kind of shield me from some of this because there's a little bit of admin involved. And so our glorious community engagement coordinator, Deanne, is coordinating this challenge, and her email is on the e-newsletter. So we'll put that in the Facebook group too. But if you can email your questions and your registration details to Deanne, then she'll link you up with Neuroendocrine Cancer Australia, and you'll be part of that team. And then the idea is you walk. So it starts today, and the idea is that you accumulate as many steps as you can. And I would just encourage you, like, again, if you do, you know, sometimes it's only 500 steps, or it might only be 200 steps. But, you know, one of the things is that there is an app with this. So I've left my other phone somewhere else, but I was going to show you the app, but you'll just have to imagine this is my phone with a really fancy little app, and you can actually graph how much you're walking. So that's quite an incentive. So I'm going to be trying and increasing my steps, and I think you may be able to watch me try and do that too, and I'd appreciate any encouragement, and I'll certainly be giving a cheer out to people who I see, you know, that might be improving their step count too. The other thing is that because we're trying to, well, Zoe's saying it's raining on day one. Sorry, Zoe, we couldn't arrange beautiful weather everywhere in Australia for this. But the other thing we would really love you to do is, there's a hashtag, like anything that we do these days, there's a hashtag, because it's about awareness raising and community building. And so the more we can get NETs and neuroendocrine cancer out there as part of everybody's vocabulary, the more we know we'll be succeeding, you know, in terms of people having a greater awareness of this disease. So the hashtag is Let's Walk for NETs. So if you're posting on Instagram or Facebook or Twitter or any of those platforms, the hashtag Let's Walk for Nets will be a great addition. So thank you very much for taking part in that. I know that we've already had heaps of people register, which is really exciting. Manuela's just asked if you need a doctor's letter or something for the Woolies. As my information is that you don't. So I know Helen, one of our really active Facebook group members, did this not that long ago. And my understanding is if you put on the form that you've got cancer, that you're being treated for cancer, there's no questions asked. So you shouldn't need to provide a doctor's letter or anything like that. The only other thing that's remaining for me to say to you is that I hope you have a really lovely Easter. I know that for lots of people, going away at Easter time is a really important part of their family kind of tradition, and we can't do that this year. I know for a lot of people, gathering with extended family is a really important part of their family tradition, and we can't really do that this year either unless you live with them already. So it's going to be a different sort of Easter. I know a lot of people are putting pictures of Easter eggs. You know, they're getting their kids to colour in pictures of Easter eggs and putting them in their windows with teddy bears so that kids who are walking around the neighbourhood with their families can see those pictures. There's a lovely thing to do there if you feel like it, or if you've got children in your life who like to do colouring in. And I guess it's just about being gentle with ourselves, with our expectations, like any time of the year where we might be thinking we'll cook a bit more or eat some different food. With our delicate digestive systems such as they are, there's some little things that might make life a bit more complex this time. So I would just encourage you to be gentle with yourselves, gentle with your expectations. It's okay to feel disappointed about this. You know, no one chose this. I mean, no one chose nets, but God, no one chose coronavirus on top of it all. It doesn't seem very fair. And it's okay to have times where you just think, oh, shit, this does not feel fair at all. So if you need to get that out of your system, get it out of your system, go for a walk. Maybe if you can, connect with each other in the Facebook group, let each other know how you're feeling, throw each other an encouraging comment if you can. And I hope that you do find some ways of enjoying yourself. Maybe it's an online concert. Maybe it's FaceTiming with your family. Maybe it's going on some kind of weird collaborative internet Facebook hunt. I don't know. Show us your pictures. Show us your let's talk about nets, or let's walk for nets out there and walking pictures. I'll try and share some too. And hope you all have a great week. Keep the questions coming. I'm taking a break. I've been sort of read the Riot Act by Simone, so I'm trying not to log in over the next 4 days. We'll see how that goes. So I'm back in the office. Be doing some emails on Tuesday, back on the phones on Wednesday next week. So please stay well between now and then. Take care. I'm going to finish up. Take care, everyone.